Now for the next surgical procedure which we'll get to discuss, we'll look at what is known as a colporrhaphy. Colporrhaphy. Okay. So let me increase this brightness. Okay. So let's just describe it to just understand what it means. So it's just used to repair or defect in the vaginal wall, most commonly to treat pelvic organ prolapse, such as cystocele, the bladder is collapsing down, okay, or rectocele, the rectum is collapsing down. Do you understand? So you just want to restore the normal anatomy around the vaginal area. So types of colporrhaphy. You can have the anterior one. This one you are repairing what is in front of the vagina. Of course, what is in front of the vagina is the bladder. Okay, so the bladder bulging into the vaginal wall. So it involves plication. You are folding and stitching the pubocervical fascia just to support the bladder again. I saying this is a typical example of an anterior colporrhaphy. Posterior colporrhaphy, the rectum is bulging at the back of the vagina. So of course you are just trying to reinforce that part of the body by stitching it too. The combined colporrhaphy, this one is when you're doing the anterior and the posterior. So it's quite as simple as that. Okay. So why will you actually do this surgery in a patient? If there's vaginal bulging or pressure, if there's urinary incontinence or retention, if there's difficulties with bowel movement, there's sexual dysfunction due to prolapse, then if conservative treatments have failed. Okay, so procedural overview is usually performed under general or regional anesthesia. The vaginal approach is not through the abdomen, right? Involves dissection of vaginal walls, then identification of facial defects, then you can also remove excess vaginal tissues. Okay, so that was it for what colporrhaphy surgery will do.